And let's get you the latest now on the Ebola outbreak in the Democratic Republic of Congo. The World Health Organization says experimental vaccines are due to arrive in the town of Bikoro and surrounding areas this week. It is the epicenter of the outbreak. There are currently 39 suspected Ebola cases with only 2 confirmed so far. At least 19 people have died, and the World Health Organization says nearly 400 people are being monitored as they may have come into contact with infected patients. 10 countries, including Uganda, Kenya and Nigeria, have put their healthcare and border officials on alert in case the outbreak spreads. Well, earlier we spoke to a spokesperson for the World Health Organization, Tarik Jazarek, about the ongoing efforts to contain the outbreak.
Well, we know that one of these vaccines is safe and efficient. It has been used at the later stages of West Africa Ebola outbreak. We are planning and making plans to use this vaccine in what we call a ring vaccination method. This is basically vaccinating contacts of people who have been in contact with someone who is being affected, and then their contact. So basically making a ring around the person who has been confirmed with Ebola. Also, health workers would be vaccinated too. It is a very complex operation. You have to remember that this vaccine has to be stored at between -60 and -80 degrees Celsius. It will take some logistical efforts to bring those vaccines, and also first we have to identify who exactly has to be vaccinated. So it's not a general population vaccine, it is targeted vaccination, so we need to have those lists of people who are to be vaccinated. Well, we have to be prepared for all eventualities. We have learned that giving predictions and timeline, it's not really best thing to do. What is really the most important is to focus on the response. So, and we talked about vaccines, but vaccines are just one tool that we have at our disposal. Vaccines cannot replace all those standard measures, if you wish, that we need to have in place, such as epidemiological surveillance, such as treatment centers, so people who are sick are actually treated to increase their chances of survival. Contact tracing, as I mentioned, that we follow people who may have been exposed, safe burial practices. We also shipped over the weekend the mobile lab, so we can really quickly test people and know exactly who is infected with Ebola and who is not. And those measures all together are necessary to contain. Countries in the region obviously are taking a close look to the situation. We are working them, we are informing them, we are checking their preparedness levels and see if we can help with that. It is important to know that for the time being, the World Health Organization is not recommending any travel restrictions. As always, Ebola, the best way to deal with Ebola is really to go to the heart of the outbreak and try to contain it there. But obviously, screening of people who are leaving affected area is something that can be considered, as it was done in 2014 in 3 West African countries.